This is a case of a patient with von Hippel-Lindau syndrome presenting with a retinal capillary hemangioblastoma as well as a tractional retinal detachment and a full-thickness macular hole. The patient did not have many systemic lesions. There is a B scan showing a tumor with traction. Decision was made for surgery. A scleral buckle was placed. There was a thick fiber sheet superiorly that was trimmed. 360, the AP traction was relieved. There was a superior tractional retinal detachment with fixed retinal folds, as well as vascular tissue and a tumor. The vitrector was used to bluntly dissect, and then a back-cutting segmentation approach was employed to relieve the traction. The remaining fibrous tissue was trimmed down. Then diathermy was used on the feeder vessels of the tumor. Peripheral membrane peel was performed. However, there was some bleeding noted from the tumor, so too much pulling was not done. The opposite hand was used to get underneath the fiber sheet to really get it off the tumor. A posterior membrane was peeled, and the flex loop was used to check the posterior hyaloid. The MaxGrip forceps were then used to gently tease off this thick posterior membrane, which was then able to be removed with the vitrector. A superior retinotomy was made in the area of diathermy, and FAX was performed. There were no other breaks noted other than the macular hole. Laser was performed to the feeder vessels as well as gently on the tumor. Silicone oil was then placed, as well as block, subtenon catalog, and antibiotics. The retina was attached on post-op day 1 with the retinal traction relieved and the macular hole closed.